First of all, thanks for having me. Um, Excited to talk about this. I think mostly excited to talk about this because I live it um, daily, and when I say that, I come with kind of an interest, like a big perspective on being on a bike. I'm going to use in general. I listed in that bio from road bike to mountain bike, gravel bike to fat bike, which is in the snow, to just kids being on bikes and starting. Um, I coach the youngest kids in the mountain bike program at Olympus High School, and formerly it was the seniors in high school with my daughter, and then I race pretty competitively. So the reason I'm just sharing that is because today's perspective on cycling um, is um, is very broad. It's a very broad group of people that are out on the roads, out on the trails, that are you know uh, semi-pro to just think of a 12-year-old. When I say the green team at Olympus High School, that is a 12-year-old, and so on this slide here, I share um, with all those groups that I just mentioned, naturally, there is a lot of growth in not just cycling, as everybody here knows, in outdoor recreation in general. And in the last, for any of you that are enthusiasts of trails and the outdoors, you would notice that in the last year and a half, the outdoors have just kind of boomed with activity like you've never seen before. I've grown up in the Wasatch Mountains on skis and on bikes, and in the last year and a half, I've never seen more traffic on trails than ever before. And the pandemic kind of pushed, hey, if you're going to be home, then you have some extra time. Where can I go? I can't travel to a hotel. Well, therefore, I'm going to go to get to know trails, or I'm going to buy a bike and go outside. I've never done it before. So along comes NICA and high school registration, and being in the coaching scene in the kind of the Utah mountain bike program, you're seeing schools have 145 racer or athletes that are signing up for the mountain bike team for their high school each year. And it's growing. It's the most participated sport in high school athletics in the and I can only share that stat for like the Utah schools that I see racing. So you're also seeing overall venues increase. I mean, you heard us talk about gravel biking. You're like, what in the world is gravel biking? And now you take a road bike and you put mountain bike tires on it, and now the gravel roads in Utah are becoming utilized, and there's race events and there's training events, and there is new races that are coming out because people are finding new ways to be able to facilitate being in certain places with new technology of bikes. So on that note, this last bullet point, new technologies, I'm not going to ask for a raise of hand on who jumps on an e-bike here or there. I'm not going to get after you, but I will say that that has generated a whole new group of people that are on bikes. And for most, it looked like we had the most nurses and doctors on the poll that you took. I would love to know how many e-bike accidents on the trails that they are age 55 and older that are like, hey, I've never been able to mountain bike to the top of Dog Lake from my house, or go in the backyard along shoreline or pipeline. E-bikes are allowed. They don't know completely, like, they don't have the background of, hey, how do I ride this on a single track trail, and disaster waiting to happen. And you guys are on the front line, and I'm seeing it because I'm in the canyons with them, helping them, or dodging them, I should say. So the reason I share this first slide is to share growth, influx on trails and on the roads and on the gravel roads. There are more cyclists than we have ever seen in Utah, and participation in races and in high schools, even from 12 years old to, I'm going to just call it 55, 60. You've never seen races sell out. Last thing I'll say about this to prove, kind of pound my point home, is that some of those races that you saw listed at the bottom of my bio, they'll accept up to like 700 racers. They will sell out in 7 minutes when they launch the link to sign up for Crusher in the Tusher Mountains, Lodoja, and Park City Point to Point sells out literally 7 minutes. And that is a mountain bike race in Park City. So any questions on just, or comments on participation before I move on here?
I can tell you, we did do a podcast with St. George and down in that area, and they are seeing an increase in e-bike injuries from our older generation.
Yeah.
Again, because they want to get out, they want to do that, but they're going faster than they should be going.
So our listeners know today, the Park City trails, essentially from Kimball Junction, across the street over to what's called Flying Dog area, all the way up to Deer Valley, e-bikes on single track trails are not allowed. On the Mill Creek side, on kind of the East Bench, basically from the University of Utah over to Corner Canyon and Draper, e-bikes are allowed. There's many that are like, hey, why is an e-bike slash, call it a mini motorcycle, allowed on these single track trails where, not only does it increase traffic, but it can be disruptive at time when someone, like you're mentioning, kind of getting to know it again, etc. But we'll get there. We'll get there on preventing. Right now, I'm just kind of sharing some data. So I mentioned that it's the highest participated sport in high school, and so what's the outcome? Like, what does this mean? Well, it means that the trails are becoming more and more congested. You're seeing more trail development along behind the university. You're seeing a lot more trail development. But then frustration sets in with those that are like, faster riders or racers on the trails. They're like, okay, here comes the Olympus 12-year-old mountain bike team up this trail, and I'm here at 5 p.m. to just bomb this trail going, 20 miles an hour. So we get some frustration going on. Then you have your trail runners, which you're going to talk about this next month. And trail runners and mountain bikers need to like get along, and learn to love each other and respect each other. And the mountain bikers, and I'll speak for the bikers, are putting off a bad vibe of not, putting a foot down, let the trail runner pass, and so it gives a bad rap to the mountain bikers. So same for the roads. There's more cyclists on the roads. And I share this picture on the side here. This is a typical 5 a.m. Morning ride for, my team, Midweli, on Monday mornings would go up Immigration Canyon, depart at 5:30 a.m. What does that mean? Like in this photo, there's probably some cut off on the right-hand side, but 15 Now, granted, this would be like in a double wide pace line trying to stay inside the white line, looks very organized going up, but do the drivers like that on their way to work? Not really, and they'll let you know it. And so we're talking today about being safe. And in my neighborhood this year, I've seen he was not on our team, but had a colleague pass, descending up a guardsman. You guys are going to know some of these scenarios. I've had another team member that had to be transferred to Indiana, where they specialize in doing transplants because of his crash on the new Cascade Springs Road up in American Fork Canyon. We've had two team members hit um, deer coming down one Mill Creek Canyon, one Big Cottonwood Canyon. And then now, so you say, like, does this just happen because these are like extremely fast, aggressive riders? Well, no, we've had a 12-year-old 3 weeks ago coming down a nice, easy path in Park City, went off a rock and twisted his front bars, and the brake lever of the front of his bike went into not even an inch away from his femoral artery. And we are on top of um, a trail up in Park City, applying pressure with a mountain bike glove until the medics came up on motorcycles and wrapped him. He went to primary children's for the evening, and all good. And I won't go into all those details, but my point in saying this is accidents take place on bikes for both professionals and 12-year-olds. And so we'll get into the how to help prevent that. Any comments or feedback on just the increase with the ratio of more people on bikes? The ratio creates more potential accidents. Um, so it really takes a community effort to work together to enjoy the outdoors. And I really believe in just proper etiquette to respect trail runners, other riders, age 50 and older on a slower or bigger e-bike that is getting out to enjoy the outdoors. But here's just some examples that on the road, we are expected to be on the shoulder or in the bike lane. And we are a guest on the car's streets. Truly, we need to think that way because it's a little bit more aggressive than just thinking like this car is going to respect me as the pedestrian on this street. So we act as a visitor on the road. Is very important. No drafting behind a car. You get behind cars inside canyons, and cyclists descend the canyons faster than cars. It is common for a cyclist to reach the speed of 55 to 60 miles an hour coming down Big Cottonwood Canyon or Little Cottonwood Canyon. And that is, it's not hard to do. That is a pace that a road bike can do. And so oftentimes the cyclist is frustrated that the car will just not move. That is not the car's responsibility. So then you get a cyclist drafting right behind a car to kind of prove a point, like, I'm right on your bumper. Car has to make a stop or a turn. You have a cyclist go through a back windshield, a back window, etc. And seen it is just not right. There's pace lining, and for those of you that see pace lining, you generally are seeing more of an organized group out on the road that are all in the same jerseys, but they're generally obeying the traffic laws, and they are a group of 10 or so. And it is important that a pace line still stays on inside the bike lane or inside the shoulder. And oftentimes you can be ticketed by, and we have seen that where cyclists can be ticketed for an infraction of just not obeying the single file line, etc. So mountain bikers should be yielding to those hiking, running, coming up trails or down trails, whether up or down. If it is a trail runner, um, they have the right of way. Um, the area where you see most of them mixing is on shoreline above the U and pipeline coming down Mill Creek Canyon, and is a place where both parties need to strive to work together, more so on the bike side than on the runner side. Um, and so you're starting to see like odd days and even days where like cyclists can be on the trails on this day, and on this day you can have your dog off a leash, and he or she can be running up to Dog Lake and no bikes on the trails. And then it's important that those days are respected, and so that we can all get along and enjoy the trails like that. Important that we respect those that are learning, and that you communicate. It's frustrating when you're on a trail or on a bike and communication is just not made between cyclists and the car, or mountain biker behind a new mountain biker, and you allow, there is no difference in road rage in cars and cars as there are uh, mountain bikers on trails and cyclists on roads. Their road rage is still the same, uh, and it's important to just chill out and then take a deep breath in the mountains and allow the right things to happen. As coaches of, take like a NICA Olympus high school team, we're very thoughtful where we train so that we aren't getting into the areas where it's like you can plan on the crest shuttle dropping off the, I call them the baggy short bombers that come down from Guardsman down Mill Creek, just flying on a downhill mountain bike to schedule. So be thoughtful, like, should I go up the Mill Creek trails on even days in the hours of 5 p.m. and 7 p.m. when the crest shuttle just dropped off like 20 guys in downhill bikes? It's not fun, but also sometimes those guys are just like absolute all out bombing, and it can be dangerous, frankly. I wish they were on this meeting, actually. So any thoughts on this before I move to the next slide?
So Spencer, there was a question from Janet asking if a downhill or uphill biker has the right of way, or is it going any direction where you yield to like a trail runner or a hiker?
Yeah, good question. As mountain bikers, we yield to hikers and trail runners, whether we are going up or down a trail. Most of the time, a trail runner will respect a mountain biker climbing on a hill and allow you to finish that climb. The reason we're sharing this is everybody knows if you are climbing on a mountain bike and it is steep and you have to put a foot down, it's likely that you're going to have to walk your bike up. So out of respect, oftentimes the trail runner will step aside so the mountain biker can finish out the climb. And when a mountain biker is climbing, it is not aggressive towards like a trail runner coming down, meaning they're likely going about 4 miles an hour, 3 miles, just barely going up. Trail runner can usually jog past a climber coming up. In any circumstance where a mountain biker is descending a trail, in any circumstance, they yield to any traffic coming the opposite direction, whether that is a runner or another mountain biker. Etiquette frankly, there is many that have not. There, you should have to take a little like 20 question quiz before you own a mountain bike, in my opinion, or go into any of our local canyons, because there's some bad etiquette. Okay, so let's chat about some other issues. These are not as related to traffic. Oftentimes, it's related to what we face out in the wilderness, and that's what makes it fun, is being outside. But many accidents that everyone here on this call sees are not brought on by two cyclists crashing, not even brought on by another car involved. Everything that I just mentioned to you of colleagues that I know that had been in those accidents were like freak accidents. Like, did you anticipate a deer coming jetting out in front of you? Whether you were in a car or on a bike, you would have been nailed. So let's talk about descending. Descending is where we see a lot of accidents, both in mountain biking and road biking. And how you can prevent those, what I just called freak accidents, were just, if you were going 10 miles an hour slower, or on a trail 5 miles an hour slower, it's likely you would have had the time to correct, get out of the way, or come to a complete stop. So everybody knows in the cycling community, on their computers, they're tracking like their time, and there's these segments built on Strava, which is a worldwide app that tracks how fast you do certain segments. And so you have people that are bombing canyons to try to win personally their personal record, etc. It's so dangerous at times, because that creates going past a car, coming around corners too fast. And here I have listed competing with cars, unexpected deer or animal, loose gravel, and the bike just sliding down a canyon into a boulder and or a street rail and other oncoming traffic. And it's catastrophic. We see it every year. And had these people been just going, thinking like, hey, I want to ride tomorrow morning, I don't think they would be going so fast. So it's only in a race where roads are typically cleared that you should be able to just let it fly. And that's just not the case with some of the Saturday warriors out there that are just like, I'm all in to just crush this, and then they get crushed. So descending is a big one. Beginners and unexperienced should ride with a ride leader more so. And I just want to call attention to the severity of not being prepared. There is a lot of places where our mountain bikers are in areas with no cell service. We have temperature swings of, this morning it was 80 degrees in the floor of the valley. It was 59 degrees at the top of Mill Creek this morning at 7 a.m. So you know that when it is a fall morning and it's 60 or 40 out in your front yard, well, it's below freezing in some of these canyons, and there are a lot of accidents that take place with not being prepared for the heat and the cold. Heat exhaustion, we see that with high school students. I pound it into my kids' minds every time they're getting on the bike, which is like, what food do you have? What is your preparation? Do you have a bike bag to fix your flats, fix pretty much everything that you need? Just overall preparedness. And the last thing I'll share on this slide is, if you show up to a mountain bike race for a high school today, and you put your leg over the top of your top bar on your mountain bike, even inside the parking lot before the race starts, and you do not have a helmet on, your team will be deducted 10 points time-wise minutes in your overall team's participation for that day. You could actually lose a race based on not having a helmet on, wearing an Olympus High School jersey, and having your leg thrown over your bike in the parking lot. And that's the way that it should be going, to teach at a young age safety. So any questions or feedback on that? This is my slide. We teach the ABCs to our it's checking air as well as having extra tubes for fixing a flat. One reason I mention that is because in this cold, you can be in an area 15 miles away from service, and imagine kind of running or walking a marathon in snow or in a trail with a bike by your side, because you have no way to get out of the canyon, no cell service, very common. B for brakes, C for chain, D for derailleur, which does all of your shifting. And then I add helmet to the ABCDs because you just simply cannot ride or participate without. Making sure you have tools to fix every one of your mechanical issues, that your nutrition is on point and you're ready for hot and cold weather. And then the last thing is just, you can eliminate a lot of injury if you are properly fit on your bike, and that kind of goes up a level in cycling to be comfortable. So that's everything that I'll share in that amount of time, but happy to share more.
Awesome. Does anyone have any questions? I know one question I had is on the roadways or the trails, especially if you're on the roadways, is there a minimum speed that is required or recommended if you're riding in specific areas? Or is it just
No,
an issue? Okay.
no minimum speed ever is a recommendation on, are you saying like on the road sharing with cars?
Yeah, so just a question. The last time I was on a bike was in Hawaii, and I did like the cycling down after watching the sunrise, and they were specific, very specific. They're like, you really need to keep a 20-mile-an-hour pace. And just 20 miles an hour scared me. When you talk like 50 and 60 down a canyon, it gives me anxiety. Yeah, and then
Yep.
yeah, so I was just a question if that was just maybe to keep, make sure that we were keeping the right time, or if that was
Yeah.
something that was part of etiquette.
No, I know exactly what you're talking about, and that is a Haleakala bike
Yeah,
suggestion as a
yeah, it
yeah.
did. Didn't sit well with me, even just 20 miles, and I had all the gear on. So, and then Janet asked, what do you mean by found with their leg thrown over their bike?
Found with, say that again.
What do you mean by found with their leg thrown over their bike?
Oh, good. Found with, if you see a little racer, he races for Olympus High School, let's say he gets out of the car, he puts his bike down in the parking lot. What they use is an example of throwing your leg over the top bar of the bike, like you're mounted, you're on the bike, and you need to pedal over to the race tent where the race begins, and you have not put a helmet on and buckled. Another team takes a photo of this other team's racer, turns it into the officials. 10-minute deduction for the team is, we saw it happen a couple times this last year. So I meant, if you're found on a bike without a helmet at a race venue, even as a coach, you can lose time on your overall. And that's kind of setting the tone for safety with our young kids.
Awesome. Okay. Janet says, thank you for the clarification. Does anybody else have any questions for Spencer, especially for folks like me that don't really cycle? It's always good to have somebody that knows the etiquette and all of that stuff on the line to ask questions to. All right, well, Spencer, thank you for presenting. And Gina, are you able to share, do you think, or do you want me to pull it up?
I've probably completely messed up Polly's computer settings, but oh
There
well.
you go. Look at that.
Did that work?
Yes. Well, I can see your background. I can't see your PowerPoint.
Okay. Weird. You can see my background, like Polly's like screen.
Yeah, just a blank screen. It looks exactly like my blank screen when I don't have anything on it.
Got it. Yeah, Jamie, do you mind sharing? Security external media of objects have been blocked. Yep, I don't know.
Of course.
Thank you. Okay. So then am I able to control this from here? Or do you have to control it?
Well, I have to see if it will let you.
Okay. Click to start remote. What?
Yeah.
Oh, that's you.
Oh, let's see if it's gonna. Yeah, it's gonna not let me do that right now, but you can just let me know when you want me to move the screen and I will be happy to do it.
Okay. All right. Well, I'll get started. So Polly and I have worked on this presentation to talk to you or talk to everyone about kind of like what you might see out there as far as common injuries on trail, what the care in clinic would look like, and then what you can do as a person out on trail as well to manage the injury. I don't know how many of you are familiar with Pink Bike. It is a mountain biking website and they do Friday fails every Friday. And so if you want to see people hurt themselves, it's kind of I don't know, it's kind of fun, but it's also kind of gory. So I put that on here. We could watch the video. I think, and as far as time goes, we'll just move forward. And then, Jamie, I will have you click to just have all of the things come up. Polly and I tried to be fancy. It was, okay, perfect. Oop, sorry. All right. A super common injury you'll see is concussions. People go over the handlebars and hit their head, hit trees, hit their head. As Spencer was saying, random things can happen too, where there's an animal in the trail, there's an animal on the road. You never really know what's going to be out there. So concussion management, you're going to want to check out the person head to toe. Maybe ask like a small sample history, see what they remember. We're all medical professionals. A GCS score isn't always a bad idea. Just where are you? Who are you? You know, what day is it? Kind of see where they're at. A mild concussion, you probably don't need to be rushing to get to the emergency department or to a clinic. Would be a good idea to set up an appointment with a concussion clinic. We have one through the University of Utah. A moderate concussion, so they're nauseous, vomiting, they might have a really bad headache, vision changes, they're repetitive in their questioning. But you see them starting to clear. Some of this is coming back to them. They start to remember the incident. Again, probably not rushing to the emergency department, but you're going to want to keep a close eye on them and then manage their symptoms. So managing nausea and vomiting, maybe making it dark, letting them sit down, close their eyes for a minute. The biggest thing with these patients is if they're ambulatory or able to walk, you're going to want to start walking. It can be a really long walk to the trailhead, kind of depending where you are. So if they hit their head hard enough that they lose consciousness, there's a good chance that there might be something else going on too, neck injury, back injury, something you can't see. Taking it very slow with these people, and an ambulance might not be a bad idea. Search and rescue might not be a bad idea. A loss of consciousness is probably a real good reason to get a CT scan and go to the emergency department. We also see this quite a bit with skiing in the winter, and it's this gray area that's really hard sometimes to be like, well, do they need to go? Do they not need to go? And honestly, if you're questioning it, it's probably better to have them go. So you're on the trail, you're with somebody, they hit their head, they say they have a headache, they don't remember the incident, they're a little bit nauseous, and they keep asking you the same question. Like I said, start walking. They cannot drive at this point. So if they drove themselves, you're looking for an emergency contact that they might have. Or you might have to drive them. If they can't tell you who their emergency contact is, they can't open their own cell phone to find the person, they need to go in an ambulance. I've had this happen numerous times, unfortunately, and they always say, I can drive, and you're like, no, you can't, you're not driving. So just be very aware of that they may say they're okay, but they're probably not, and they just don't know any better. Next slide, Jamie. Any questions with that?
Gina, have you seen many people wearing road IDs as they come in? They may not be able to say who they are. Their bracelet should, any serious person on the trail should be wearing that. I'm just trying to show that it's got important information.
Honestly, it's been a long time since I've been in the ER, and that was still kind of a new thing. I don't know if there's other ER folk there who have seen that more recently. I carry a note card in my pack that has my name, my information, emergency contact, and then I have clear tape wrapped around it, so it's waterproof. But I carry that with me anytime I go on a bike ride. So if you don't want to spend the money on a road ID, have ID of some sort with you, just in case you're the only one.
Yep.
And Gina, I can say, I think when we talked about, when we were doing our rock climbing, one thing that they talked about was having that conversation with the people you're riding with beforehand. Or, you know, if something happens, this is who I want you to call. If I have a head injury, this is to know that, or I have this card in my pack. But what do you think when the folks are riding alone?
Yeah, that's actually going to come up later on in this, all of that. It's good. No worries. Can I answer that later, or do you want me to answer it right now?
No, later works.
Okay. All right. So other common injuries, shoulders. This is my poor husband, used with permission. For those of you who have seen shoulder injuries, I know we don't have Sage Pod anymore in the ER, but it was like summer season hit, and it was like dislocation, clavicle, AC joint, clavicle. It was wild. But this is what a shoulder separation looks like. You'll see a picture of a shoulder dislocation shortly too. and they look kind of similar, and it's hard to tell. But honestly, on trail, that's not necessarily your job. And treatment course for clavicles, shoulders, whether it's AC or dislocation, are going to be similar. You can click through. I think it's like 3 clicks for this one. So this is just kind of a quick pick of the different grades of AC separation. This would again be someone who probably went over the front or landed directly on their shoulder, and those ligaments get torn, and that pops up. It's not necessarily a break. It's not necessarily a serious, severe injury that's going to need an ambulance, but it's pretty uncomfortable for the person. Next slide, please. It's going to be, yeah, rest, ice, sling, pain control. You usually start a little bit of physical therapy. It heals on its own. Sometimes these people need surgery. And then on trail, position of comfort, if you can. You can get pretty creative with different types of supplies you already have in your pack. A spare inner tube for bike wheels work great as slings. Using a jacket to kind of hold it next to their body. And the other big thing that I wish more people did is put bike patrols numbers in their phone for canyons, Park City, Deer Valley. If you're out mountain biking, you're probably fairly close to one of those resorts at any point in time. And giving them a call and being like, hey, I'm with a person who has a shoulder injury. Can you meet me with your UTV, your motorbike, whatever, at the nearest road or trail intersection? Because trying to manage an injured person, their bikes, their pack is really difficult and can make the extrication out of the trail situation really hard and longer than it needs to be. So extra hands, I always employ extra hands, even extra people that come along on trail. As Spencer was saying, we've got an abundance of humans on trail now, and if you can get extra people in, it can be helpful. So I have my notes on my phone, and that's why I'm looking this way. Next slide. Okay, this is a shoulder dislocation. You can see it looks kind of similar. The one thing that I've learned, especially in ski clinic, is see if you can see me. If I dislocated this arm, I would not be able to bring my hand up and touch my other shoulder if this shoulder's dislocated. So that's a pretty simple test to see if that person is dislocated. These are hard. They're incredibly painful. Those muscles tense up around that joint. That shoulder wants to be back in its spot. But do you put it back in is the question. And then Jamie, next slide, please. And then kind of click through these so they all come up. So close. Okay, perfect. Possible complications with a shoulder dislocation, that takes a lot of impact to move that thing out on most people. You might be looking at a humeral head fracture with that, which could be complex, or a brachial plexus injury. If you relocate that shoulder, you risk causing more harm than good. Sometimes people are like, oh gosh, it dislocates every other week. It's totally fine. I'll just pop it back in. And then they do it themselves. Other times they're in so much pain that they can't move because it hurts so bad. And then you're looking at how far are you from the trailhead? You know, where's your nearest exit? Can somebody else help me? And if all of those answers are like, I'm 2 hours away from the trailhead, there's nobody else out here, it might be a good idea to maybe try to put it in. The longer shoulders are out, the harder they are to get back in. So if you're looking at a 2-hour walk at a normal pace with bikes, you're looking at a 4-hour walk with someone who's in a ton of pain. So you can put gentle, sorry, I'm gonna do this again. If the person's arm is bent, you can put gentle traction down. They're gonna scream at you and probably swear. But if you have another person who can massage like scapula and try to loosen up those muscles, that can sometimes help bring it back in. Deep breathing, they're not going to want to do that, but you want to encourage it. And then if you get it back in or you don't, splint in a position of comfort using whatever you have in your pack. Shoulder dislocations are hard, and I feel so bad for the people who have this happen to them. But once you get it back in, they're like, it's fine, I feel great. And you're moving on. It's pretty incredible. Next slide, please. So a little plug for the University of Utah Orthopedic Center. I didn't know this until I started working at the Snowbird Clinic, but we have a specialty urgent care here that's called the Sports Injury Clinic, but it's staffed with sports medicine specialists. So you can schedule an appointment or walk in. These are our hours and location, and you'll be seen by a sports med doc that day, and they can take care of, non-complex breaks. We obviously can't do conscious sedation and then no narcotic pain medication here, but you fell on your hand, you're like, is it sprained, is it broken? It kind of hurts more than I think it should. You can come in, get an x-ray, see by a sports med doc, get referred into the orthopedic center, and probably get seen faster than going to an emergency department or an urgent care. So go orthopedic center. There's your clavicle fracture. These buggers hurt too. These may be displaced or not. These hurt, and it's going to be the same treatment as a shoulder dislocation, as an AC separation out on trail. Recruit help, find your nearest exit, place in a position of comfort for the patient. Next, please. Wrist, hand, scaphoid, which is a small bone in your wrist that can cause a lot of problems. If it's deformed and you're like, oh, that's broken, you want to check your sensory, your motor, and circulation as soon as you can. Remove jewelry, rings, gloves if you can. Sometimes these people are not super psyched. If you have any way to cut a glove off so that hand doesn't swell, and then it's even harder, and then you can see fingers, that's ideal, but sometimes you don't. You're going to splint in a position of comfort and check the CMS again after you splint. And then even as you're walking down, you got them in a good, comfortable position. You still want to keep checking, see if anything changes. Sometimes just like moving around can move something enough that it now becomes more urgent than maybe what the original injury was. Again, recruit help if you can, and find your nearest exit. There's a theme here. Next slide, please. All right, these poor humans who really crash big. You want to keep them comfortable as you can. This is a good point to ask a sample history. I think, again, medical professionals, a sample history should kind of ping your schooling. So you're wanting to ask kind of your basic questions of allergies, meds, last oral intake, and get just kind of a baseline of what they've done today, and then good information about their history that can be helpful to the hospital or EMS. I would not give these people food at this point. Small sips of water are probably okay. Obviously, if you're like in a backcountry expedition and you are hours and hours and hours away from any sort of care, whether it's search and rescue or why am I blanking? A hospital. Whew. You might consider something small, but I would really discourage that at this point. If you suspect a back injury or a neck injury, have them start by wiggling their fingers and toes. Do they have numbness and tingling anywhere? It's hard. Like, you start looking around and thinking, where could they land a helicopter? Where is my nearest exit? Is it going to take longer to hike this person out, or is it going to be advantageous to get search and rescue coming? Because maybe search and rescue is 2 hours out from where you are, but it would take you 2 hours to hike out, so you're probably going to start hiking. These situations are challenging. I had a friend who went over the front, ended up lacerating her liver, and we hiked out because she was able to move her hands, her feet. She was able then to like bend her knees, bend her arms, didn't have any numbness or tingling. We sat her up. She could move, and we ultimately came up to the conclusion that it was going to be faster for us to help her out with the three of us than to wait for search and rescue. So judgment call is huge in some of this, and sometimes there's no good answer. Again, tips for helping search and rescue: know where you're going, know where you are, check beforehand, check weather, and pack accordingly. I always have a headlamp with me in my pack because you just don't know what's going to happen. You can use headlamps to signal. Then you've got light at night if you need it. And then again, maintaining history or obtaining a history for these patients to give to EMS. Lacerations.
Gina, for just
Yeah.
1 second, I'm just going to launch the final polling question just because we are a little over. So for those that have to leave, they can answer that. But for those who can stay, please do that.
Yeah, and I'm almost through this.
Well, and now because I logged into another one, it doesn't want to do that. I will launch it for my other one. So you keep going. But for those that are that need to go, I'll launch that poll in just 1 second.
Okay. Lacerations. Arterial, venous. Arterial, as we know, is usually bright red, usually spurts. Venous is usually darker and just kind of oozes. Regardless, you're going to hold pressure. And we always want to look, you want to look to see if the bleeding stopped. Has it stopped? Maybe this time, maybe not. But don't do that. Hold pressure. Avoid the want to check on it. Just keep adding dressing to it, whether that's a t-shirt. Spencer had mentioned that he had to use a mountain bike glove to hold pressure. Whatever you got, just to hold direct pressure. If it's over a joint, probably going to the emergency department. If it's just a remedy, you've got bleeding controlled, urgent care can probably suture it for this person. Elevate. I carry a 10 cc syringe with me so I can irrigate out wounds if needed. That says implement, but that's supposed to be impalement. Obviously, if like a stick impales, you don't want to remove it. And again, start walking. This kind of leads into the next thing. My husband last year was on the Crest, which is a major bike trail. This rider came along. He was on his own. He went over the front and he basically core sampled himself in his groin. And they're up on the spine, which is this prominent ridge. And they called search and rescue. They were there for 2.5 hours holding pressure, waiting for search and rescue. This guy couldn't walk, obviously. So again, there's another testament to know where you are, where are your nearest exits, because they had to tell search and rescue what the best route was to get to them. And these search and rescue people are people who are local to Salt Lake City. And this group, because it's all volunteer, you don't know who you're going to get. they didn't know the best way to get to the spine. And that's a pretty prominent place in Salt Lake City. A lot of people know what it is, especially if you're an outdoors person, but this group didn't. So another plug for know where you're going, know where you are. Next page, please. So here we go, takeaways. Again, know where you are, know where you're going. If I am going out by myself, I leave a note at home with my information, and maybe this is overkill, and I text somebody else. So if my husband is out doing his own thing, I leave a note at home that says where I went. And then I also text my mother in Minnesota and say, hey, I'm going on a bike ride. I plan to be out for 3 hours. You know, I'm going here, or this is the trailhead I'm parking at. I will text you when I'm done. And then she knows that if something happened, or that if I didn't get back to her at the end of that ride, that she would call my husband and let him know, hey, this is weird, she's not back. So I think 2 points of contact, if you're going to go out alone, is really smart. If you come across a rider who's down, unconscious, I check them, check their pack, check their bike. Some people have their names on their bikes. I have my name on my bike. It's just kind of one of those weird things. And check their phone. Sometimes you can open up a phone to an emergency contact. Sometimes none of this information's there, and that sucks. And then they come into the emergency department as a Jane or John Doe, and social work, I don't know how they do it, but they are detectives and they can find out who these people are. It is really impressive, but that's hard. That's a really hard situation to be in. So if you can do your best as an outdoor recreator to cover your bases, leave a note, text somebody, you're going to put yourself in a good position if something bad happened to you. Again, you're going on a ride with somebody, talk to them about their sample history beforehand. You know, who do you want me to contact? Where would you want to be treated? If you can get their contact, their emergency contact into your phone at that point. It seems like overkill, but it's crazy when stuff really hits the fan and all of a sudden you have this, you feel so much better. You feel so much more comfortable. You can be really creative with splinting supplies. Like I said, an inner tube for a bike tire is a great sling. Sticks work really well for bracing a knee, an ankle, a wrist. Jackets for slings. So I'm just looking at my notes here of what I have. Even a bike, like a backpack that you carry, you can create a sling out of. So be creative out there. Be aware of when the last time you had cell service was on trail. Be aware of when you last crossed a road. Just know your surroundings, know where you are. Again, know where you're going. Search and rescue. After you've biked about an hour from a trailhead, you are now a backcountry rescue at that point. If you are an hour away from where you started, you're probably looking at 2 to 3 hours to get out. So keep that in mind as well. Next slide, please. What I carry in my pack, I actually don't carry a whole lot because it's heavy, and I'm one of those people who doesn't like to carry more weight than needed, because it makes it harder. I carry a roll of Curlix, a 4-inch ace bandage, a 10cc syringe, a headlamp, and a pen and paper, so I can either leave a note or make notes on things if I need to. So that's when I'm just out on my own, or maybe with one other person that I know is also prepared. If I'm leading a group ride or teaching a clinic, or going on a big expedition for the day, I'll carry steri strips, 4x4s, gloves, like medical gloves, just in case I run across somebody I don't know or don't want to touch it because it's gross. Coban, I think they work better than Band-Aids. and then like little packets of bacitracin and a SAM splint to help me with splinting if needed. So just kind of take a look at this and think about maybe what you would want to pack. Anybody else carry other random things? Duct tape is another one that I have with me at all times. I don't consider it part of my first aid kit though. Ready? Okay. A tourniquet. Okay. Yeah. Awesome. Tourniquets, they're not that heavy, but yes, absolutely throw that in your pack if you have one, or get creative with how to make one. A roll of Curlix and a stick, you can make a pretty good tourniquet out of that too. Well, that is my presentation. Anybody have questions, comments, concerns? Is I way off base on anything?
I did have a question for both of you guys as we talk about, because I hike in Mill Creek quite often with my dogs, and I know I don't have cell service. What do you guys use for alternative service, GPS? What are your recommendations?
So
If
there's a couple of,
go ahead.
sorry, Spencer.
Yeah.
There's a couple of different products out there. There's a Garmin InReach. There's something called
Yes.
a bib stick, and these are little GPS devices that you can send, like you can press a button and it sends a message to your emergency contact. They're really not all that expensive in the grand scheme of things. Spencer, what else would you suggest?
I'm gonna support the InReach by Garmin. You can also text message on the newest InReach. You can't make a call from it, but I can literally be on the spine or lower where you have zero service and send a text message and the location to my wife, to medical. So Garmin InReach is the best, most affordable on the market, in my opinion.
Yep, I would agree.
And just your favorite places to go biking. I'm just going to ask as we're ending.
Oh man.
I'm not telling. No.
That's right. That's right. That is a good.
Your second favorite.
That's a good.
Second favorite place to go biking.
Man, first, mountain biking, Alta, gravel biking, Uintas.
Yep. Yeah, probably the same. Probably same for me. The new gravel roads that are up in Heber called the Wasatch Wall that are starting to. There are races that go to Strawberry Reservoir and back, and Mill Hollow and back, and is becoming kind of a new mecca for gravel racing. It's kind of cool.
Yeah, it is.
And there's nobody there except cows.
And sheep and sheepdogs.
I think because if you tell a lot of people in Utah, I'm going to Mill Hollow, they'll be like, where? I like to go fishing there. So
Yep.
Oh, cool.
it's a nice place to go fishing.